Hello, welcome back to Bewitching Brain. My name is Devesh and I'm a rising second-year medical student at the Medical College of Wisconsin. And we are so happy to have you with us and encourage you to subscribe and share. Take good care, be safe, and help others be safe. So in the last couple of videos, we explored the brainstem and cranial nerve functions. We'll now be starting a new series on supportive structures of the brain, including blood vessels, the blood-brain barrier, meninges, and cerebrospinal fluid. Let's get started. Okay, so the blood-brain barrier, otherwise known as the BBB, allows us to protect our brain because it permits what can enter the brain. So for example, if you have an infection that is transmitted through the blood-brain barrier will prevent it from spreading to the brain and cause further complications. So there are three components of the blood-brain barrier. We have tight junctions. We have the basin membrane with parasites right over here. This is the basin membrane. These are the tight junctions. And we have astrocyte foot processes right here. And we'll go into more detail into each of these components. So the first component is tight junctions. The blood-brain barrier has endothelial cells which line the inside of the blood vessels. So at the BBB, these cells are closely associated with one another via tight junctions, which forms a tight barrier with a limited passage of compounds. These structures help maintain the integrity and permeability of the vessel. So right here we have a normal blood vessel, right, with fenestrations. Fenestrations are basically these holes, these pores within a blood vessel that allows some compounds to be able to move. They're big enough that a lot more compounds are able to move through this. Here you have these tight junctions right over here, which prevent flow of compounds. Another important component is the basin membrane and parasites which are embedded in the basin membrane. So you have parasites right here. They are thought to be derived from a common precursor to smooth muscle cells. They have two main functions: to provide structural support to microvessels and to signal to the endothelial cells to influence permeability and growth. So although the mechanism is not elucidated yet, it is also thought that the parasites may play a role in BBB immunity by sensing and engulfing blood-derived microorganisms. This image right here is by Sophia Masaccio. She is a fellow medical student as well at the Medical College of Wisconsin. The previous photo in the previous slide was by Dr. Teresa Patitucci. And then this photo is also by Dr. Teresa Patitucci, so thank you so much. So the third component is astrocyte foot processes. They form a star-like structure, so as you can see from this image, it kind of looks like a star-like structure. They play many roles, but to simplify it for the sake of this video, they are the support cells that contribute to the structural properties of the blood-brain barrier. So they are also known to recruit peripheral cells, such as white blood cells, to the CNS through the BBB to fight off infection in case it does get to the brain. However, there are some areas without the BBB called circumventricular organs, right? So these organs, they don't have the BBB. So we know that BBB is an important structure to learn about because of the properties which include tight junctions, basin membrane with parasites, and also astrocytes that prevent infection progression into the CNS. So however, as I said, there are some areas that don't have the BBB, and these circumventricular organs, they're centered around the ventricles. And the reason they don't have the BBB is because these areas are responding to signaling molecules, so they need access to the bloodstream. So because of that, they lack the BBB. And since they need access, one example would be like the posterior pituitary. So the posterior pituitary is an organ that produces ADH, which is vasopressin, and oxytocin. So that is directly released into the bloodstream, and because of that, it doesn't have a BBB in that area. So next time, we're going to be covering meninges of the brain. I do want to give special thanks to Dr. Teresa Patitucci at the Medical College of Wisconsin. She provided us the figures for this video, and also special thanks to Sophia Masaccio. Thanks for listening, Brainiacs. So tune in next time for more.